Well, good morning, everybody. It's about due time that actually I get this one recorded, so I'm going to tell you a little jaunt about this. It is April 25th, so welcome. I'm Dr. Nicole Moore here, and I just wanted to tell you I've recorded this one and done this webinar without sound. So I did the whole thing and it was great, and then when I got done, I never turned the microphone on. So here I am back again to tell you of my awesome mistakes and to share something that is super dear to my heart. Functional medicine has been a part of my life now for approximately 5 years. I think I got introduced to it 6 years ago. I mean, the concept's always been there, and we'll dive into a lot of that, but this has definitely been something I have been very passionate about since I've learned about it. So a little bit about my journey, if you guys don't already know, you might want to skip ahead after we record this. You might want to skip ahead about 3 to 5 minutes. But anyways, a little bit about my journey. So I graduated in 2003 from high school, went on to be a massage therapist for about 8 years before my patients or my clients finally decided to tell me they need a doctor like me. I was helping a lot of people get to the right care and listen to them. And so it really inspired me to go to chiropractic school and go the non-conventional route. So I did that, learned the trade of chiropractic, but I also really held on to the primary care aspect of my training. So a lot of you guys don't know or may not know that chiropractors get really good training in cardiopulmonology. We get really good training basically in all of our systems, right? So I'll spare you the details, but we get all this awesome training. And so when I was in school, I actually would ask people, hey, what else are you doing? What other things are you into? And one of the girlfriends of mine one of my colleagues there, she was like, oh, functional neurology. It's saving my life. And I'm like, what? What is that? So I got into that, and a lot of you might know Dr. Schmo. He came and taught. He graduated a couple years, I think a year or two before me, but he came and taught one of our classes there. He just filled in and subbed for a teacher a couple times, and he kind of introduced the studies into functional neurology and Dr. Carrick and all these other things. And so the biggest thing for me was, oh my gosh, I'm getting migraines all the time. Chiropractic isn't helping anymore. Massage therapy isn't helping. Relaxation. I mean, you talk about it, it just wasn't helping. So I went and saw him, got introduced to that field. It fixed my migraines. And so I went and took all of the Carrick modules, the 300 hours it takes to get ready to sit for the board. Obviously, you have to do a lot of studying beyond that, but I finished all of that about a year after I graduated. So I got introduced into functional neurology probably about 2013. Started doing classes about 2014, I believe it was, and then I finished with my classes early 2016 or late 2015. And I graduated from chiropractic school in 2015 as well. So along my journey of deciding, okay, functional neurology is this awesome realm of non-surgical, non-medicine way to treat the brain. And a lot of you guys, hear about it on the news for athletes with TBI and what is that called? CTE and all these other head trauma things, right? So those are the areas that I was like, oh my gosh, this is what I'm going to do. And then I got introduced to functional medicine through Dr. Josh. And when I was introduced, I'm like, oh my gosh, this is the other component that I've had questions on, and that is going to answer everything that I wanted to do. So functional medicine is kind of the tie that's combining and holding together my education as a chiropractor, my knowledge as a practitioner, and then my education as chiropractic neurology, because we have to have fuel and activation. So fuel, the metabolic state, functional medicine is what drives or can slow our neurologic state, which is, our other component. So Functional medicine was introduced to me when I did my last internship or externship with one of the chiropractors here in the Twin Cities, Dr. Josh Huffman. I don't know if you know him. Shout out, whoop whoop. Anyways, so basically functional medicine has been kind of where I've been spending my study time in the past couple years. And so I just really have a passion for it, because with my knowledge of neurology and my knowledge of the body and physiology, now I have the knowledge and the capacity to combine it together and to understand what came first and how we can really get to the root cause of your issues. So I'm going to jump ahead into what we're talking about today. So for those of you, I'll put a little mark on it. I think I can do that, where we're actually going to start talking about functional medicine today, okay? We're going to dive into a bunch of things. So I want you to get pen and paper or your popcorn or whatever, you know, if you want to have a watch party or, you know, invite your colleagues, stuff like that. I would love to hear comments, questions, anything else that may come up during this talk. If you hear me getting short of breath, I am 7.5, almost 8 months pregnant. So don't mind me. I'm trying to correct my posture, but you know, when the baby gets big, they get big. So anyways, I hope you guys enjoy this as much as I like to talk about it. So bear with me, grab your pens and papers, and definitely just hold on to your seats. Let's see. Let's share. Okay, so I'm going to share with you the webinar here. And we're going to talk about functional medicine and why you might jump on board and why you might actually agree or disagree with this model. So basically, I'm going to read a few things that I have written, and I'm going to talk about a few things, and this is going to be kind of a longer one, so you might want to take a few days to go through it, or, you know, like take a stop or whatever you need to do, okay? So let's talk about current conventional practices. So that would be like your medical model at your MD. The National Institute of Health defines conventional medicine as a system in which the medical doctors and other healthcare professionals treat symptoms and diseases using drugs, radiation, or surgery. Let's take a look at some similarities between conventional and functional medicine. So we both practice by a licensed medical professional. So I'm licensed, I'm a chiropractor. Functional medicine doctors can be DCs, nurse practitioners. They have some sort of legitimate professional degree that they have spent a lot of time and years on, and they have a passion for as well. They both DCs and MDs, so conventional and functional, are evidence-based, and we utilize diagnostic testing. So basically, we get our answers. The way we get them is from testing, from evidence, right? So peer-reviewed or other studies that we do and publish. And then we do have a licensure to practice wherever we're practicing. You can always ask us, so don't feel like you can't ask your practitioner. Conventional medicine is extremely effective for treating acute problems such as heart attacks, broken bones, and physical trauma. While conventional medicine is a good tool for many things, functional medicine is built on the technological advances made in conventional medicine. The approach to chronic conditions is where conventional and functional medicine begin to differ. Let's check it out. All right. So functional medicine, unlike conventional medicine, functional medicine focuses on identifying and addressing the root cause of the disease, not just symptom treating. Functional medicine examines every factor involving, including symptoms, genes, environment, and lifestyle factors that treat the cause of disease, not just the symptoms. Functional medicine was developed based on the understanding of the importance of an individualized approach to disease cause, based on the evolving research, nutritional science, genomics, epigenetics. So genomics is our genes, right? And epigenetics are the effector, the environmental input or effects on the genes, according to the Institute of Functional Medicine. At the heart of functional medicine lies the understanding that When the underlying causes are not addressed, problems can progress and worsen. Lifestyle factors such as diet and stress are often leading to irritating, chronic, and painful medical conditions. The body is well equipped to heal itself. However, a poor diet and excessive external stressors interfere with the body's ability to heal naturally. Our body can heal itself. And we talk about this in broad terms, and I think a lot of people are like, yeah, this is great. If you give plant water, sunlight, and some soil, right, you're going to give it what it needs. It just naturally knows what to do. You introduce disease, right, or you take away sunlight, it's going to wither away. You take away water, it's going to wither away. So when you have deficiencies in the body, your body's not going to have enough tools to actually do what it's supposed to, so it's smart enough to actually go in and go, what is necessary, right? What's essential and what is not essential. Essential would be something like you have to breathe. So we're going to make sure you have oxygen, right? So you can't be anemic. You have to have blood glucose levels at a certain amount. So we're going to regulate that. And anything above and beyond that at this point is like, well, I don't know. Do you really need to have sex? Do you really need to have happiness? Do you really need to have, and you can name 50 other things that we don't need to have because it's not essential. It's a benefit. And I sure would love to be happy and joyful and have energy and sustain that throughout the day and get good sleep and, you know, all these other secondary or non-essential aspects of life. But unfortunately, we get to a point where our body just starts breaking down when we get chronic disease. Our body knows what we need to shut down, what we need to look at first, what we need to look at second, and so on. The following factors are what we truly set functional medicine apart from conventional. So we do, in our office here, we focus on the symptoms cause. I mean, think about it. A lot of people come in and they'll be like, oh, I just feel fatigued. Okay, great. Let's look at why. So we'll do blood labs. We'll do different things. We'll look at your history. And I mean, our history is pretty intense. So you're going to spend a good hour to an hour and a half with the practitioner and probably another additional 30 to 60 minutes filling out paperwork just to know what's going on. Everybody's different. But if we can't see all that, we're never going to actually get to the root cause. And that's why when you go in the conventional model, you get 5 to 20 minutes tops. You can't get to the root cause of everything because they're strapped, and that's a whole nother conversation. Holistic view of the entire body rather than a collection of separate systems, right? So if you go to an MD and you are having an issue with psoriasis, or you go to an MD and you have something that needs some rheumatology, you know, like RA or psoriatic arthritis or something of that sort, they're going to reference you out to them and they'll refer you out to them. So what happens is now they're going to look at your skin, or they're going to look at your, I don't know, heart. They're going to look at your joints. They're going to look at an independent body part where functional medicine will go, okay, that's great, and these symptoms should go away, but this is the real true cause, and how does that play in the whole body? So we're trained to know what is playing on what. What's the physiology? What's the endocrinology? What is all of these different hormones and neurotransmitters doing in the body? And why are the organic acids off, or whatever it is? Where are the deficiencies? Functional medicine examines the body, mind, and spirit to determine physical and emotional aspects of your disease. So everybody knows that there is stress and there's physical and emotional stress. It improves the body's innate healing ability. So functional medicine will improve your body's ability to actually heal itself. And that's what I commonly see in practice. And I tell my patients all the time, we're going to fix your problem. We're going to give the car gas if it's out of gas and see if it runs. If it doesn't run, then we go, okay. So now we know the gas tank's full, we check the gauge. Now what else is problematic, right? The radiator. I mean, can it not cool down? There's so many different aspects to the body when you look at it as mechanically or physically. Yeah, there's just so much. Why do we prefer the functional approach? This lady is intently listening to this other lady. It's great. I love it. So what we do, we spend a lot of one-to-one time. As we discussed, the goal of functional medicine is to determine the root cause of an illness or disease in order to treat treat the symptoms. So we have to treat the cause of the symptoms in order for the symptoms to dissipate. You know, we're not going to just give you something, drive something in the body when we have no idea what it's going to do because we didn't check anything out, right? It's not the throw a dart at a dartboard and see what sticks. Because there's a lot of examples in like real life. I just had a patient who, I think my testosterone's low. What do you do? Most of the men will go to these men's clinics and hopefully they're functional medicine based, and sometimes they are and sometimes they aren't. And low testosterone is not their problem. And when they actually get testosterone, it makes them feel good for about 6 to 12 months. And it's great. And then they crash and they go, well, what's wrong? It worked for so long. So they up the dose and it works again. But unfortunately, they're not finding and fixing the root cause of what's going on. So there's definitely some things that you have to investigate when you are looking at a chronic or acute issue. Like say you got bit by a tick and you have a bullseye and now you have Lyme disease and it's just diagnosed. I mean, obviously there's certain protocols and you want to do certain things, but that's going to be an acute issue, right? That will turn into a chronic if not fixed, or if your body can't handle it and fix itself. The immune system is an amazing thing. So let's just jump into some basic principles. Functional medicine is a personalized healthcare treatment to treat individuals, not diseases. So this is a concept that has been thrown around a lot too, and it's really nice to know that there's physicians out there like myself and a lot of my colleagues who want to sit down with you and actually take on your case and teach you this is what the body does and this is how it does it and this is what's going on with you specifically and this is how we can take care of that. And to really, really help the individual long term understand where their body's coming from, where they're headed to, why they need to make certain changes, what's really bothering and causing a lot of these things, okay? Research shows disease and illness is composed of a complicated network among various systems in the body. Functional medicine utilizes the science to understand the relationship among these functions and help the body self-regulate and heal. Tapping into the natural ability promotes natural healing and even prevention of many diseases. This is so important. When you actually find what's going on and you create an environment where your body is sustaining life the way it should, it's going to fix all the things that we didn't even know what was wrong with you in the first place that might have been a key player in what's going on. So you might have joint pain, or you might have headaches or migraines, or you might have an autoimmune process going on against the thyroid, right? Hashimoto's or Graves' disease. You might have these things that are going on, but the underlying factors aren't going to be as present, right? So we're going to see certain markers and we're going to see things in your history, but your body's going to know way more than what a practitioner will ever know. And that's the really good thing about what functional medicine can help with, is it helps the body heal the important foundational things and allows the body to actually take on its own purpose, like it has been since birth. Is okay, we need to grow here, we need to make sure this cell dies, we need to, modulate and regulate the system, the body. Did you know that health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease? So we need to make sure that you are physically, mentally, and socially well. Hard to think of in this world, isn't it? Conditions. So there's a lot of conditions that we treat here that are super easy to treat, and a lot of people come in and they're on a statin or they're on some other medication that they don't need to be on because simple life changes might help, or just knowledge of what your body does allows you to empower yourself to make these choices into health. Not everybody is going to be an advocate of eating clean and exercising and, like all these other things in the extreme. But when people find out that you can moderate things and at the beginning maybe be a little more strict for a month or two, see the changes happen, and then just live moderately and address things as they come, you're more likely to come in. So some of the conditions that we talk about are going to be cardiometabolic conditions, diabetes, high blood pressure, and heart disease. Neurological and psychiatric conditions, so depression and attention deficit disorders and migraines. Digestive disorders, IBS, ulcers, chronic pancreatitis, acid reflux. Acid reflux is such an easy thing to help when you actually replete the acid of the body and stop taking those blue pills. I get off my soapbox. Autoimmune diseases like RA, so rheumatoid arthritis, lupus, and celiac disease, skin disorders, psoriasis, acne, eczema, hormone problems, thyroid condition, chronic fatigue, and symptoms during menopause. These are all things that I see on a regular basis in my clinic. And they're all things that when people learn how easy or how simple certain life changes can be to address these, they go, why isn't this talked about in the medical community? And we don't need to get into that because we all know why. You can take your own stance on that. So basically, we need to restore balance and help prevent chronic conditions. Our main goal is to repair and restore the body's natural ability of healing and restoring system balance. Each of us are different. Care plans are unique. They do include a lot of time on your own doing things. So the only way you're going to get healthy is if you start taking initiative and owning your own health, right? So that's where a lot of people, they love going to the conventional model because, oh, I got a pill and it'll help me for 6 months. Okay, functional medicine is changing the paradigm and putting it back into your hands. So you don't have to see a conventional medicine provider, an MD. You don't have to see a functional medicine provider all the time. There's a lot of things that we can change. Your lifestyle changes, diet and exercise, we talked about that, but it's specific to your treatment. Stress management, detoxification, nutritional supplements. Less is more. When you give your body time to heal, that doesn't mean popping 18 pills at breakfast, lunch, and dinner and at specific times during the day. I mean, sometimes certain things to replete the body, great. Never long term. I'm never going to be like, okay, we have to. And it's like, sometimes I have patients that come in and they bring, I call it the black bag or the black box. I don't want to look in your black bag or your black box. Why? Because there's so much stuff in there that we don't know what you're taking is interfering or helping, or what your body is confused. You're giving it all these things that it's like, I don't know what to do with it, so I'm going to put it here and I'm going to drive this. And when you see patients' relief of and struggle with coming off of a lot of these supplements, that it's just like, why are you taking that? Let's get you to eat real food, right? Botanical remedies, prescription medication. So I definitely think prescription drugs are necessary in certain cases. There's certain cases that I'm 100% on board, and I respect each one of your decisions to be on them, and I will tailor accordingly. I will also educate you on the research and let you make your own decisions on them, because sometimes research is heavily on one side. So I try to get both sides all encompassing so that you can actually make an educated decision. So each plan developed between patient and functional medicine professional practitioner aims to restore imbalances. So we want to gain nutrients, and we want to lose extra things that don't need to be there, right? So we need to get things balanced for your specific condition and prevent chronic conditions. So we can prevent a lot of different things. There's a lot of stuff out there. I mean, gosh, this is heavily in the news, but type 3 diabetes. What's type 3? Did you know there's type 1, type 2, type 3, type 1.5? You look at all these and go, what? That's weird. Why are there so many? So you have like insulin dependent type 2, and then you have non-insulin dependent type 2, and then you have insipidus and mellitus and all these other ones. Type 1, autoimmune against the pancreatic cells, right? Insulin dependent. Type 2, usually diabetes mellitus, right? Typically not insulin dependent right away, but can progress into insulin dependent. So usually you'll get that, then your body will start an autoimmune attack against itself, and they call that 1.5, right? Diabetes 1.5, where it started out as type 2, but now progressed into an autoimmunity, so now it's type 1.5 because it's split in the middle. And now Alzheimer's and dementia is type 3. So how many other signals and chemicals and research papers do we need to say sugar is an issue? But it's not sugar. See, there's a huge uproar about, oh, sugar's bad, sugar's bad. Okay, it is. But it's bad because we're so depleted of nutrients and we're so out of shape and we're so unconditioned. Our blood sugar is so unregulated that that's what causes a lot of these diseases. Number one thing that keeps coming out of the research is deficiencies caused by stressors called life is what causes disease. If we have enough nutrients, if we have enough available, our body can sustain and run for a very long time. But we deplete these things with stress, which is chemical stress, emotional stress, sugar stress, toxin stress, parasitic stress. You just keep naming them. I'm off my soapbox now. Anyways, okay, so a study published in the Journal of Health Economics, the value of disease prevention versus treatment, found that the demand value prevention always exceeds that of treatment. Disease prevention is the process by which anticipatory actions can be taken to reduce the factors known to lead to specific conditions. Millions of individuals die each year from preventable conditions, including heart disease, cancer, chronic respiratory disease, stroke, and diabetes. Millions of individuals die from preventable conditions. Take your health into your hands. Spend a little time and get in the now. Take advantage of your health and prevent heart disease, diabetes. If your doctor says you're getting close to diabetes, you better do something. Jump up, call me, call somebody in the functional medicine realm, make sure they're licensed or certified in functional medicine and that they're licensed in their field, and go get some help. It's time. So what is the research saying? Okay, we research everything, right? If you want to put your kids in school, you research what school district you want to live in. You want to buy a house, what's a good value? Do you want 4 bedrooms, 3 bedrooms? If you want good health, guess what? You got to put in some time. So we all know that smoking, not exercising enough, not eating healthy, and not maintaining a healthy weight is going to cause disease. So what are the opposites? Don't smoke. Get at least 3.5 hours a week of exercise. Eat fresh food. I'm going to be doing a food school here coming up. So if you don't know what food is, because most people go, oh, well, you know, I eat food. I go to McDonald's. I eat food. I get it out of the freezer, out of the bag. It's, you know, it's food. It's like, wait a second. So what constitutes a food? And I will get into that if you ever want to know. If it grows on a vine, if it grows in the ground, and you don't process it, right? Those are other options too. If it grows on something that gives life, or an animal that has life, that has a good sustaining food source called grass or normal chicken feed, those are going to be something that you can call food, right? It's not processed. A French fry is a very processed potato, which is not a vegetable, by the way. That's a starch. So we need to learn, how can we even eat food? What is food? We're so far away from food. And maintaining a healthy weight. Now, a lot of times people are like, I've done everything. You see the commercials. I've done everything and I can't lose the last 15 pounds. So Sonabella or whatever that is, let's go freeze our fat off. It's like, well, we only get a certain amount of fat cells. So why are you freezing it off? All you have to do is desensitize the body to sugar, basically take the sugar away from it, which will sensitize your receptor sites to insulin, which your pancreas will be happy because then it can produce less insulin to get the same amount of sugar into your cells, which then, guess what? Decreases inflammation, decreases edema, and increases energy while decreasing your fat. There's so many things that is just common sense, but nobody knows where to go get those answers. So ask your functional medicine practitioner. These behaviors, the ones we were talking about, not smoking, exercising, making sure you eat healthy, maintaining a healthy weight, they attribute to 93% of diabetes prevention. 93%. 81% heart attack prevention. Did you know that I think it's like if you eat one serving of vegetable, you decrease your blood pressure 8%. So if you have 8 vegetable servings, 3/4 cup to a cup, 8 of them every day, you're going to decrease your blood pressure 60-some% or whatever it was. And it's like, hello, I'd have to look at the research to be specific on the percentages, but literally eat your vegetables. 50% stroke prevention, 36% cancer prevention. Basically, if you eat real food and you quit eating fast food and you actually prepare your meals a little bit and learn how to eat, that is 50% of our problem. You know, when you talk about bodybuilders, it's like 85-90% of what you eat, 10% of what you lift. I mean, you have to lift to be an actual like heavy lifter because you have to condition, and you also have to lift when you want to actually do a show because you have to define those muscles. But that's all contributed by what you eat. You have to feed the body a certain way. You know, these models, they have chefs, they work out, they do all these other things. I mean, some of them are anorexic, but most of them nowadays are trending towards the healthy style of eating. So we talked about heart disease, modifications to your diet. Eat your phytonutrients. Do you know what that is? So phytonutrients is going to be in your plants and your herbs. Phytonutrients is the nutrients that the plants or herbs will carry from their own growth. That actually stimulates the immune system. It's a really cool factor, and it does things that even a lot of the research can't even show right now because it's so new to like studies, and it's just really cool. Stabilize your blood sugar, get more fiber, eat less processed food, right? And eliminate foods with hydrogenated fat. Margarine is not a food. Shortening is not a food. Okay, get rid of your cookies. Get rid of your, unless you're making them at home with olive oil and maybe some clarified butter or grass-fed butter. Okay. Anxiety in the gut. Anxiety is a normal part of life. However, when anxiety doesn't go away, it can interfere with daily life. Conventional medicine approaches anxiety by balancing neurotransmitters in the brain. Functional medicine takes a look at the root causes of anxiety. So what is the cause of neurotransmitter dysfunction? Functional doctor may start by examining the gut, right? So we look at how is your microbiome, right? We know that your brain and your gut carry similar, if not the same, well, depending. Our serotonin and dopamine act on the gut as much as it does on the brain. There's so many research articles on serotonin being like 90 to 95% in the gut and less in the brain, and that's they're so much intertwined. Gut inflammation, SIBO, small intestinal bacterial overgrowth, and fungal overgrowth. I know there's some stuff in the news right now about Candida, and I believe it's like, it starts with an A, Candida A. It's not albicans, it's like, or maybe it's C, curiri. I don't remember. I read a huge article on it. I went through and looked at the literature. When we look at all these funguses and we look at Candida and parasites and we look at bacteria, there should be a balance. And when you give your body what it needs, that balance actually helps maintain the immune system And the immune system goes and says, okay, we cannot create this environment anymore because you're eating healthy, so you're going to have some die-off reactions. Candida will grow less. Parasites usually don't like it. Sometimes you have to go in and treat some infections like H. pylori or, there's a lot of infections that you might need to treat that come up. But in the interim, when you fix the gut, your brain can work better, right? And so what I learned in functional neurology was, well, there's kind of a quotient. How much of this is brain and how much of it is gut? So some people come in and they had a TBI, or they had some kind of head trauma, and they're like 85 to 90% brain issues. So we have to get them to have proper eye function and movement. We have to get them to be able to be in certain positions. And we have to train the brain again to understand where they are in space, right? But then you have some that it's like, okay, well, yeah, your brain's dysfunctioning, but you can't even hold your eyes open, right? So we got to look at the metabolic side of this and go, why don't you have fuel delivering to your brain properly, and what's going on? And that's where you kind of find the function of both, right? So you do the neurologic workup and you see how much of this is the brain, right? You can see if somebody has a really good diet, but their brain is not functioning and they've had trauma, you're going to be focusing on the brain. Most of the time, it's going to be a good mixture of both, right? So metabolic issues in the gut, you have something going on, whether it's insulin resistance, whether it's an infection, anything like that, which will mess with your serotonin and other neurotransmitters, okay? So we get more specific in our treatment, usually, for patients. So each patient, like we talked about before, is different. But here we're going to talk about nutrient deficiencies. I've been kind of chiming in about that. We don't eat enough variety of food. I mean, a lot of these things up here, most people don't even know what it is, and that should be common, right? So you got like chia seeds, and you have garbanzo beans and pumpkin seeds, and probably chlorophyll, it looks like, or some kind of grass, right? You have, I always forget the name of those little things, the orange things, but you have walnuts, and you have goji berries, and you have, looks like it could be blueberries or plums, and then you have coffee beans. A lot of people, we don't even eat the rainbow. We don't know what these things are. We don't implement them in. We don't understand how do you cook with this or eat this. So therefore, we don't get what we need out of our food, right? And then you throw in the other factors such as the soil depletion and the GMOs and all the other things that actually strip away phytonutrients and general nutrients of each individual food. So there's links between nutritional deficiencies and disease that we can't overlook. Your functional medicine doctor, me, will most likely want to get labs and urine. So basically, I'm checking to see, how are your vitamin levels? How are your nutrients? And why is that important? Because if you don't have enough, you're never going to run the car. You're never going to get your brain functioning. You're never going to help with the neurotransmitters. You're never going to get to that place where you were when you're 16, 25, 35, and all of a sudden you're just like, oh, it's just not the same. All right, so let's look in further a little bit about functional medicine and conditions of the skin. Cortisol is noted to be a stress hormone that's been associated with major contributing number of chronic conditions. Cortisol plays an essential role in circulatory function. Excess levels can be deadly. But we need cortisol, and that's where we come into some issues. Negative health results of stress include damage to our immunity, right? Our immune system, decreased risk of diabetes and increased risk of diabetes and obesity, poor cognitive function and focus. So cortisol is a hormone, and it affects many parts of our body. So cortisol is something that our body is sensitive to. And in our fast life right now, we are spending a lot of different times in these stress responses, whether it's what you're eating, what you're doing, what you're not doing, if it's deficiencies. So if you're hypoglycemic, your blood sugar drops, your cortisol takes over. So your cortisol spikes, your adrenal glands do this for as long as they can. Then you get other effects such as, I don't know, when you look at menopause, where your hot flashes coming from. Where is your fogginess coming from? On your frontal lobe, right? So we look at women and our frontal lobes, they run off of progesterone. Men, our frontal lobes run off of testosterone, if I'm remembering correctly. And if your cortisol levels are always making up for your blood sugar dropping, right? If that's always happening, the same organ produces a lot of our testosterone, estrogen, and progesterone. And when you don't have ovary function, such as in menopause, you start getting insomnia, mental fog, fatigue. You get hot sweats, night sweats. I mean, all these symptoms come about. There's so many women that come in here and get off their bioidentical hormones and don't have hot flashes, night sweats, insomnia, go through menopause super awesomely without symptoms. Why? Because you're correcting what their problem is. And in this example, it's constantly regulating their blood sugar, not having enough nutrients. So you get them, the right nutrients. Deficiencies, everything goes back to that. So there's so many things here. Our skin is the largest organ and the most visible organ on the body. Our skin can reflect deeper issues in health. One of the most common chronic skin conditions is eczema. This is an inflammatory skin disorder that's resulting in red, dry, and itchy skin. Dermatitis is an acute skin condition with similar symptoms. Infections, on the other hand, can be caused by viruses, bacteria, and fungus. Eczema, rosacea, psoriasis, all of these things, these are autoimmune disease against our skin. Herpes, shingles, and warts. Bacteria infections can spread to other parts of the body. Cellulitis, athlete's foot, ringworm. They're funguses. So our body, we have an optimal area for these funguses to survive if the immune system can't fight it. I mean, it's like, hey, look at mom and dad are gone. We're going to have a house party. I mean, that's what happens in our skin every time. Antibiotics are commonly used to treat the infections. However, they can weaken the immune system further and lead to chronic conditions. Thus, treating skin conditions from the inside is necessary to address the root problem. Tea tree oil, witch hazel, chamomile, apple cider vinegar. These are all really natural ways that can actually really help the body, right? Coconut oil and tea tree are antifungal. Witch hazel and chamomile, anti-inflammatory. Apple cider vinegar helps with fungus. They don't like these environments, and you don't have to use antibiotics to really get the results you need. You need to fix your immune system, so you could have these chronic issues. Poor nutrition, definitely food allergies. Anti-inflammatory foods are helpful to take. Vitamin C's, flavonoids. If you're anemic, iron deficiency, take some iron. There's a lot of things. Drinking water. Most of us are so dehydrated. If you don't have water, how is your body going to heal its skin? It's just so commonsensical. But until you find out why you're having these issues and how commonsensical these are, you're never going to put value to it. And that's what a functional medicine doctor does, is they take everything that you say, everything that's been happening, and they turn it into, here's what's going on in your body. Here's why you need to take this into account. Here's what you need to do with it. Here's the importance of this for you, because your body is running like this. And that's where it's really beneficial to bounce that off somebody who actually understands how the body works as a whole and really drives health in your body minimally, like by outside factors, because we want to allow your body to work without interference. Stress management. Stress kills. We talked about that before. I shouldn't skip over it that fast, but we could do a 5-hour study on and talk about stress. These are all going to be, so detoxification, food, emotional, physical, all these things are stressors, right? So detoxification, otherwise known as biotransformation in the literature nowadays, basically functional medicine, you aid in natural detox. So detoxification, I know there's like 3-day detox, 7-day detox, this kind of detox. These commonly strip your body to an already stripped body, okay? You don't want to drive or push a detox when the body is already deficient in something. So you should be guided by a practitioner who understands what they're working with and why they're pushing that and what they're doing and what you should expect. And is it too fast? Is it too slow? Are there other contributing factors? What's going on? Commonly, biotransformation or detoxification is something that you work at for years. Our body becomes toxic over time, right? So we don't want to dump a bunch of toxicity until your body is ready and can handle it. There's 4 phases of detox, right? So we have 1, 2, 3, and 4. A lot of people, they get 1 or 2 or 3, but not all 4 of them. The pathway is running efficiently, so then you're not excreting, or if you are excreting into the bloodstream, you're not excreting into the toilet, and you're stripping, you're not actually pushing a vital nutrient into the body and allowing the body to dump the whatever toxin it needs to into the bloodstream and allow the cell to either create its own death, apoptosis, or to strive for life and become healthy and join the rest of them. So there's so much in detoxification that somebody like myself, functional medicine doctor, will really, really try to help you with. And we can help you the best because we're going to know your history. We're going to know what's going on specifically, so you won't have to guess. You're not going to throw a dart at the dartboard and go, we're going to work at this pathway. No, we're going to know exactly what we need to do and which comes first and how to treat that deficiency to help with a nice, slow detox for your body. Okay, supplementation. Many patients wonder if they can get all the nutrients needed from the diet alone. Ideally, food would provide everything we need. However, there are several factors causing diet alone not to be enough. For example, depleted soils, storage, transportation, genetic alterations, all impact the nutrient content of everything we eat. Examples of conditioning required additional supplementation include obesity. So when they're getting into the farmers and stuff, they're doing what they need to do. We need crops, we need to grow stuff. If you have the ability to get the correct soil at home and grow your own herb garden and grow your own vegetables for part of the season. I live in Minnesota, so that's not always something I can do, right? I don't have a greenhouse. I don't have millions of dollars, and I am definitely not a horticulturalist or herbologist or whatever you want to call that. But basically, sometimes we need to drive pathways at a higher amount. So somebody who's overweight, who's obese, who's morbidly overweight or obese is going to need more nutrients. And that's why a lot of obese patients who come to me, they're like, my doctor told me I need to lose weight and I need to exercise. So I cut my calories down to 1,000 calories a day, sometimes 500 calories a day, and I'm not losing anything. Well, if you're starving because you weigh 400 pounds and you're eating 500 calories, your body's going to hold on to those 500 calories and more. So you have to eat according to what your body weighs so that your body knows, hey, I can jumpstart my metabolism and I can start getting rid of the fat. So definitely I've seen awesome positive life changes in the morbidly obese. A couple patients started at about 400 pounds, lost anywhere between 100 and 150 within the first 6 months. No issues with joint pain, ache pain, They felt great. They had the most energy, best sleep that they've had in a long time. They couldn't understand, like, the concept of eating food was so far from them that they just didn't understand. And that's all their body needed. Now, some of them are different. They come in with like diabetes and 5 different other diseases. And you're like, okay, well, our expectation is X, Y, Z. So what do you expect when you come see a functional medicine practitioner like myself? You can expect that your visit will take a bit more time, right? I want to know you. Functional medicine practitioners are looking for in-depth information according to your personal and family history, circumstances around your first symptoms, and the goal is to uncover underlying causes of your health problem. I want to know your detailed history, physical examination. So we'll do a neuro and ortho exam to make sure you don't have musculoskeletal stuff, and lab testing. So I want to know 95% of what you tell me is what's going to show me where I need to investigate. 5% is going to be your labs and stuff like that. It's going to confirm the conclusion. It's going to make me so I don't have to throw a dart at the wall and see what happens, right? We can see a number, we actually dive in there. But your history is what tells me, and your exam tells me what to do. The Institute for Functional Medicine suggests a list of questions to ask practitioners to get the most out of your experience. Remember, functional medicine requires you to be an active participant in the problem-solving process. This means you have to be involved. I tell you what to do, I tell you why to do it, and you accept or decline, and that's how we go. So you should ask somebody like me, how do you describe your practice? Do you work with other clinicians, nutrition professionals, health coaches, etc.? Do you have information you can send me? Do you have experience treating my conditions? What are the main therapies that you use? So I'm a chiropractor. I use chiropractic. I use some supplementation. Nurse practitioners might use bioidentical hormones. Medical doctors who have their functional medicine, they might use some drugs, they might not. It's whatever our field dictates, that our licensure dictates, that we will actually be utilizing. Are we typically covered by insurance? Typically here, I'm going to answer a couple of these questions. HSA, flex spending accounts, the directive of your own can be used. But as far as like Blue Cross Blue Shield, things of that nature, it's just not usually covered because it's prevention, typically. Some of your chiropractic adjustments, if you need them, may be covered. I am out-of-network, non-provider at this point in my career. I've just really wanted to work with individuals, so I keep my prices very competitive and pretty low so that I can have the one-to-one with no interruptions of insurance. That is a personal preference. You might find that some functional medicine practitioners are all insurance. Whether that's covered or not, I don't know. However, some people like myself, I do a free phone consultation typically to make sure that the patient knows what exactly we do. So it's kind of the step before they come in. And then we do a comprehensive exam. I have you fill out the proper history paperwork, which, like I said before, is about 30 minutes, maybe even up to 60, depending on how detailed or, things you have to pull up or remember. Once the patient comes in for a comprehensive exam, we get labs done. I compile all the information that you've given me, that I've collected from our exam, and that the laboratory sends back to me for your results. And we either do further testing if it's needed, or I compile a treatment plan right away and say, okay, these are the things we need to start on. These are the things that's caused by that. And this is how long it's going to take and what it's going to take to get you there. And we have that discussion at the beginning. So before you even commit to anything, I lay it all out, and you might say, I feel great. Okay, good. I'm glad I know this, and it's not that important to me, and I'm good. And I have some patients that go, okay, well, I want to do this part, but I don't really understand this part. So can you explain that a little bit more? And I'm going to decide not to do that part. So this is what I want to do. And then there's the people that go, okay, this is my year of health. And I really want to take care of this because I'm 45, 50 years old and I'm ready to take my life back, or whatever age, right? So I work with the extremists, right? All the way down to the minimalists. And we see results and get to your goals that you need. So that's kind of how it breaks down for that. I will be posting below some information as well as references. So definitely email our office. I will post that below as well. Our email is info@ptbodytherapy.com. Our phone number is 651-633-4291 if you want to call us and set up a free consult. It's very minimal. It's 5 to 10 minutes. We just kind of chat about what's going on and see if it's a good fit for you. I am in Roseville, Minnesota, and right on the corner of New Brighton, Minnesota. So if that works for you, awesome. I do telehealth as well. So meaning maybe our first couple of visits, you come into the office, we make sure that it's a good fit. We find out everything because I have to do an exam and stuff. And then we can see what happens from there. Okay. I wanted to thank you for listening. I really love functional medicine and what it's doing to our current healthcare model. There's major change going on, and I hope in the next couple years that this becomes the norm and that more and more people prevent disease and that we see less and less insulin resistance, diabetes, and dementia in the next couple decades. So again, thank you. And if you have questions, post them below. And definitely have a great week. It is Thursday right now when I'm recording this. So, and have a great weekend. Thanks again.